Good morning and welcome, everyone. Thank you for joining the eCongress. We recognize that we are living in unprecedented times and different circumstances, and we hope that you and your loved ones are doing well. My name is Kayan, and I work as part of the project team. Before we start, I am here to introduce the Crowdcast platform. We would like you to be part of the conversation and simulate face-to-face interaction. Here are a few reminders. On Crowdcast, polls are located in a tab just below the video feed. We have poll questions. Please check this area to answer them periodically. Questions and answers are located in the same section. This is where you can submit any questions or leave a comment on a question. Once the host has answered the question, you will be able to view it in the Answered tab. You can also upvote questions that others have submitted. Chat is located to the right of the video feed. Please say hello and introduce yourself. This is where we can directly communicate with you and other attendees before, during, and after an event. We may also invite any participant up on screen to join them as a guest. You will receive an invite and be prompted to check your mic and camera. If you need to leave early, you can still watch the replay. Just click the same event URL on screen or log into your account and go to My Events. This session is also accessible through our Facebook page at fb.com/telehealth-policy and our YouTube channel at bit.ly/T telehealth, capital P, policy, capital Y, capital T. They have limited functions, but we will monitor and questions and comments so our presenters may share them on the screen. We would like to apologize in advance as we are unable to provide a sign language interpreter for today's session. We will be re-uploading this and last week's session with a sign language interpreter. In the meantime, our YouTube live video is available for auto captioning. We can confirm that in succeeding sessions, the eCongress will be able to include a sign language interpreter. Apologies again, and we will strive to do better. One final reminder is that this is an evolving process. We request everyone's patience during this time, given difficulties in connecting from each of our locations. There may be a few distractions, but we hope to have a smooth program flow for today's program. To start, I would like to introduce our moderators for today. Dr. Portia Fernandez Marcelo is a professor at the UP College of Medicine and leads the AHEAD Telehealth Policy Project. Ms. Charity Tan is the Chief of the Knowledge Management Division under the DOH Knowledge Management and Information Technology Service, and she is an avid supporter of everything related to CRVS, most especially medical certification of cause of death. Please welcome, and I am now giving the floor to Dr. Portia and Chief Charity.
Good morning, everybody. We are very excited to see everyone again for another Telehealth Thursday for the Telehealth Policy eCongress. Diba, Madam Portia? Where our objective is we are going to set out the roadmap for a telehealth-enabled future for all Filipinos. Okay? Oh, by the way, when we're talking about telehealth, DOH is looking at two models for telehealth. One is information and education, and another one is for clinical services. Yung telehealth for information and education aims to support medical professional learning. Okay? So dapat, if not for COVID-19, umarangkada na tayo sa universal healthcare implementation where telehealth is front and center. But then, for example, as we organize our hospitals sa UHC, sa Universal Healthcare, napaka-importante ng aspeto ang telehealth because in the local health system, there will be different levels of hospitals, level 1, may level 2, may level 3, and may apex. Ngayon, of course, the level 1 doctors in the level 1 hospitals might need telementoring. And this is an example of telehealth for information and education. But this is already for in-service doctors. When we're, how about the pre-service doctors? It's a lot easier to institutionalize telemedicine in the if at the very start during their academic years na-introduce na si telemedicine sa mga student doctors, student nurses, and other paramedical students. In fact, as early as 2010, we already have guidelines from CHED on including telemedicine in nursing education, and we also have had guidelines from UP Manila as frontier on advocating for telemedicine in instructions. So, ano na ang nangyayari dito? This is way back 2010. So, fast forward 2020, we will be hearing from Dr. Iris and from CHED about what's happening to telemedicine ngayong for pre-service and in-service. Okay? So, today's session is aptly titled Telehealth-enabled Healthcare Workers. How do you pronounce this? Yung may X pa in between, I don't know that. So, I'm not an next gen. We will discuss the importance, challenges, and action points so our healthcare workers are better equipped with the necessary knowledge and are competent in the use of telehealth. Between last Thursday session and today, we have uploaded on Facebook, sa sinabi kanina, and YouTube an introductory video for today's session. Si Dr. Nem Kahutagana, Dr. Harry Hamoy, and Attorney Ivy all shared their insights on the role of a telehealth-enabled health workforce in our situation and in our future. So thank you, everybody, for those who have watched it. And we invite you to watch, like, and share it to each of your networks. My co-moderator here will present a summary of what has happened last Thursday. Take it away, Madam Portia.
Thank you, Charity. And magandang tanghali po sa ating lahat. Special pabate kay Dr. Lims Abrojena from Ateneo School of Medicine and Public Health, as well as Dr. Mortera of Coronadal. Thank you for listening in, and many more who are here. And special thanks also for 800 plus of you who really joined us in the launch. So to present for the summary of our presentation of the discussions, pakita namin sa inyo. So our format is that we present what are our recommendations from the coming from the insights through our telehealth policy project consultants, and then we hope that we can provide feedback on that so that our recommendations to the Department of Health is really parang shaped also by your thoughts. And through our many platforms, these are also opportunities for you to speak up. Okay, so what are the highlights? So on the screen, you can see, so definitely we have yet to really clarify the scope of practice of the different health human resources involved in for telehealth. So this is not just for the doctors, but also all health professionals and even allied health professionals, the technology people, they should be part of that. So regulations should leave no doubt as to the nature of telemedicine as an act constituting practice of medicine. That is so very clear. So at the same time, the definition should consider including special provisions to account for possible involvement of individuals, other physicians, in the provision of these services. Now, the scope of practice may guide the identification of competencies. Yes. So for those of us who are in the formal school system, we really have to still work to define all of these. Although there are already, this is not old, so there's something to build on. Another very clear recommendation is to establishing the standards of care for medical allied professionals as well as support services. So this should have provisions to direct involvement of standards of practice, support for research and quality assurance, as well as program review. And then true to the idea of universal health care, this regulation should favor a multi-sectoral approach. And like the previous items, standards of care may guide the identification of competencies, especially for those who are now in practice. So while medical education or undergrad education, we have time at least to catch up on that. But those who are already in practice and using telehealth, we have to really catch up. And this is where the professional societies have a role in developing all of these standards of practice. Another slide, yeah. So licensing and accreditation, credentialing, and privileging. And then the role of the Department of Health or a specific body designated to manage and monitor the implementation of telehealth services. So here, the coordination role of the RDOH with the professional societies, the PRC, the CHED, and other stakeholders, including especially for the curricula of the various health professions and allied allied disciplines like information technology, computer science, should be also eventually be part of continuing professional development activities. And definitely the inclusion of data privacy, security, and patient safety in all of these telehealth courses. So there is more, and we want please continue to provide input into our into our I can't understand, sorry, into our presentations in the video and YouTube as well as Facebook. Okay, so after all of our the telehealth discussion, so definitely we hope that we can view all the videos that we are posting and then weigh in on that. And our format is our consultants present our recommendations, and then we want to hear from you. And then this time, during this Telehealth Congress, we will have our panelists to also weigh in and provide their own critique about our presentation. And hopefully, we will definitely allot time today so that your thoughts are also going to be read as part of this conversation. Sige. Anything else? Pwede na ba ang ating next speaker? Yan. Okay. Meron pa. Another, three other recommendations is that the telehealth should be regarded as a subsystem within the bigger healthcare delivery system. And as such, but it should also be managed with well-defined organizational structure, task, and technology. So within your hospitals, within your clinics, within the rural health unit, the use of telehealth should be within, within predictable bounds. So it should be standard. It should be standard practice. So we have to really define all of these processes within our own existing organizations. Now, while our current telehealth workforce is trained to provide quality health care at all levels, it was all in the context of providing them in face-to-face encounters at the clinic ward or at home. And we all know that we had to take some time to understand the situation, listen to those who've had some experience already, and generate that kind of evidence so that policies can actually be put together. The existing policies right now are ad hoc in that sense, and we hope to contribute through this policy research to enhancing whatever is existing right now. So telehealth would require new sets of skills for our future health professionals, which is not part of the current education curriculum. For health professionals to be effective in telehealth, they need to be provided with those needed competencies, and therefore we need our faculty and a curriculum committee of various disciplines to start formalizing all of these. And again, the good news is we're we don't have zero experience in that. So that's something that we can build on. Sige po. I think our next speaker should be ready, pero gusto muna pong tawagan ng ating look, I need to say hi to Patricia from Line Care Incorporated, Korea. Hello, hello. And here is also from Christian Payumo from Social Watch Philippines. We especially engage Social Watch Philippines so that they can weigh in more in a focused manner into all our recommendations. I also want to, maybe we can look into the poll. Yeah, sila pa ba? Sige. Now we're ready. Sige. After so much ado, we'll now call in our first speaker, who will also share what the Philippine Medical Association is doing. So our first speaker is the newly elected president of the Philippine Medical Association, Dr. Benito Atienza. Is a LASALite. He graduated from the De La Salle University College of Medicine. He is a pediatrician by training, and Dr. Atienza, with other doctors, started the Child Community Health Workers Foundation in his hometown in San Jose, Batangas. Yeah, a doctor after my heart, going home to serve. So his effort was really intended so that school children, parents, teachers can be trained as health workers against the prevailing typhoid outbreak at that time. He has won numerous awards since then. So please welcome the National President of the PMA, Dr. Benito Atienza. Good afternoon, sir.
The success stories of our telehealth since the implementation and of DOH for the teleconsulta last March. The Philippine Medical Association started our teleconsulta. We will start with the one done in Quezon City. We'll go first with the we have since April of this year, we have the pre-consultation through teleconsulta, coordinated with this is recognizable seriousness of challenges overwhelming the healthcare industry. The Philippine Medical Association, in coordination with the League of Data Privacy and Cybersecurity Advocates of the Philippines, or LEADCAP, partnered for a telemedicine system. Our objective is to prevent the overcrowding of hospitals due to COVID-19 pandemic, to prevent unnecessary exposure to COVID-19 for patients needing the medical care, and refill the prescription via electronic prescription. And third objective of this project is to provide professional medical advices through non-physical contact, and to set up a referral system within locality for both COVID and non-COVID patients. We remember our colleagues who were lost, and we are thankful for our frontliners for continuous fulfilling our duty, for our Filipino patients. Actually, this project involves 150 volunteers doctors around the Philippines. Even meron tayong mga doctors from abroad, especially from the Beta Sigma fraternity of FEU College of Medicine. Since the DocPH was launched in April 24, it has been serving 800 to 1,000 patients per day that time, kasi ito yung kasagsagan ng COVID noong April 24. Each patient will click the DocPH, and they will answer a series of questions, 13 questions, and 5 questions is about COVID. If their symptoms are not COVID, they will be referred to a specialist in our group. Then if COVID, it will be referred to other COVID hospitals. The official statistics report of the technology provided that this digital online consultation for our patients' healthcare, average clicks per day is 300 hits. Average calls of patients ending into medical consults per day is 1,000 medical consults. We have an average triage drop call. Ito yung nag-answer lang, curious lang sila, and hindi na tumutuloy doon sa A1 robotics. Frank calls na consummated 10%. Answer to COVID inquiries via artificial intelligence or AI robotics triage, 75%. Non-medical inquiries, dental, psychological services, 10%. 5%. Our geographical spread calls from Luzon is 75%, 15%, Mindanao 7%, overseas 3%. This is our for COVID, non-COVID patient. I now present to you the project of the Quezon City Medical Society in cooperation with the Philippine Medical Association. It is all started for 3 weeks, and as of now, they have served 5,000 patients. This project is intended for the COVID patient. Ito yung mga nag-positive sa swab. This is called the BANTAI COVID. This BANTAI COVID is a project of Philippine Medical Association in cooperation with the City Government of Quezon City, then the Quezon City Medical Society, and the Quezon City Health Department. Advantages of this program: it can reach almost everyone, old and young, all strata of the society, everyone with cell phone, with internet, or without internet, in all networks. Can segregate the infected from non-infected remotely, and with this can institute proper preparation for to face infected. Can analyze the data real time for counter-checking measures initially instituted, available 24/7. It provides more efficient interactive action between the suspected infected authorities or in different programs of management depending the level of isolation simultaneously. No medical worker or frontliner will be exposed unprepared, preventing death and unnecessary sickness or quarantine. Can have uniform program adapted to all areas of society as mandated by governing body of the city or state. Advantages of this program, again, it resolves the coordination issues between the departments because they see the same platform at a particular point in time. Next, advanced text notices prior to the patient arrival creates proactive measures to be adopted to prevent problems. Example, infectivity in admission. Much needed rest is preserved for the personnel who are performing tasks because of alerts are in place. Automation keeps a structure that efficiently guides the team for much needed support even during wee hours in the morning. The project protocol. Triaging. COVID patient, COVID positive close contacts are enrolled to RESU in Verio program after the RT-PCR test at the CBT. Next. Daily reminders of social distancing, hand washing, and personal protection are given to the enrolled patient. The AI-SMS system will do contact tracing and daily monitoring of symptoms via SMS for all in-home quarantine suspected and probable. 4. Interactive questions and answer. No face-to-face contact is done, and data is visible to all Quezon City leadership and health department in real time. Fifth, health coaches, doctor volunteers from Philippine Medical Association will triage both the symptomatic and identified COVID positive. Corresponding disposition will be given depending on the symptom and comorbidities. Referral to hospital or quarantine facility managed by barangay health workers. Patients are directed based on the guidelines provided by Philippine Society of Microbiology and Infectious Diseases, Interagency Task Force, and the Department of Health. Analytics are in place to give the city and the state a picture of the pandemic situation in real time so as to guide in resources allocation and management. Daily census is given as to the real-time status of the incidents, admitted, discharged, recovered, died, quarantined, in the home and in the mild quarantine facility, and asymptomatic negative contact of COVID positive. The health department becomes aware of the scope and magnitude of the situation that aids them to carve a solution to the situation. Network of public and private hospitals are being tapped to support the AI initiative to create more holistic synergy of the different health systems in participating city. This is the, I will not go into details of this general flow. They can have this and I will share it to you. The flow of how they manage the patient with positive RT-PCR. Systematic diagram. That's all. Thank you very much.
Yay. Thank you, Dr. Atienza, for sharing what PMA did as a collective responding to the COVID pandemic through telemedicine. So maybe it's a good introduction. Yeah. So, yes, Charity.
Thank you very much, Dr. Atienza. In fact, we first heard about BANTAI COVID from the Quezon City Health Department. Kasi very happy sila that BANTAI COVID is there to assist them during this time of pandemic. So, so thank you very much again. Let me introduce our next speaker. She graduated from UP College of Medicine and ranked number 7 in her class. She is a certified diplomate and fellow of the Philippine College of Physicians and Philippine Society of Endocrinology and Metabolism. She holds a Master's of Science in Health Informatics, the Medical Informatics track. Her thesis was on e-learning in medical education. And she is the guru of e-learning. So please welcome, and I am now giving the floor to Dr. Iris Isip-Tan.
Good afternoon. Thank you very much po. I'm going to share my slide now. So for the 5 minutes that I've been given, let me share 3 key points as a medical educator, as a professor of health informatics, and a practicing endocrinologist. Number 1, knowledge and practice gaps limit telehealth education. When the pandemic happened in March, I started to use email on top of the mobile phone to keep in touch with my patients. Prior to the pandemic, I already had experience titrating insulin, getting lab results, and then giving instructions to the patients about medication changes. However, I'd never done a video teleconsultation, and I was also getting queries from other colleagues on how to do this, because they also told me, if I don't know how to do it, how can I teach it myself? So that is why my first point is knowledge and practice gaps limit telehealth education. And so what happened was, in April, voluntarily, the faculty of the UP Medical Informatics Unit, some of our grad students, our alumni of the program, decided to come up with guidance documents. So take note that we call them guidance because we felt that when we say guidance, we're giving advice. We didn't call them guidelines because we felt it wasn't our place. So we wanted to reach out to stakeholders in order to get the guidelines developed. For our point, we only said guidance. And so I am very happy to share with you that recently the Department of Health and the University of the Philippines, Manila came out with a joint memorandum circular about the practice of telemedicine, and all the 5 guidance documents that you see here on the screen and which you can still access. There are PDFs available at the bit.ly account that you see on the slide. So all these 5 guidance documents are actually referenced in the joint memorandum circular. The second point I'd like to make is that we need to determine telehealth competencies. And in our MIU guidance document, we tried to do a literature review as to how the telehealth competencies were set elsewhere. And I'm sharing only one because I have 5 minutes only. Here is an article by Sharma on the core competencies for virtual healthcare. And he divided it into 3: digital communication and website manner. Number 2, the scope and standards of care. And number 3, virtual clinical interactions. And if you go to the article, he's subdivided that even more. What are the things we're supposed to teach for each of these 3 competencies? Recently, very recently, the UP Manila Chancellor, Dr. Carmencita Padilla, organized the UP Manila Telehealth Committee. And one of the objectives that we set for ourselves is to actually integrate teaching and learning experiences for our trainees, our students, in whatever telehealth initiatives will be happening inside the university. So in doing so, we hope to contribute to also looking at what competencies are needed. So the last point I wanted to make is the time is now for telehealth. So we need to augment medical education with pandemic-related telehealth opportunities. And I've been getting a lot of inquiries because I'm also the director of the Interactive Learning Center on how we can use telehealth, teleconsultation to teach our students, our residents, and fellows. So one of the first things that we developed at the MIU is the website rubric. So it's also available through that account, through that link. In the rubric, we are already giving sort of some guidance on how the students or the trainees should set up for telemed, like what lighting, the internet speed, what gadgets, but more importantly, their website manner. So how do you translate your bedside manner to something website? Because now you have a webcam in between you and the patient. So we need to maintain the physician-patient relationship despite the distance. So I've also reviewed some of the training opportunities for medical students, for nurses, for pharmacists, etc. But I will only share one now, telehealth in internal medicine clerkship, and this was an American model. And what they did was they included the clerks in a telehealth clinical rotation. And so there are 4 processes there. They're included in the encounter setup, in the appointment initiation. During the encounter, they remotely shadow the resident or the attending physician as these 2 people do their history and BE, but sometimes they will also be allowed to do it this way. So then they learn how to do virtual physical exams. And then post-encounter, they receive feedback given in real time. So because, as you know, several of our outpatient clinics are closed, and so we need such teleconsultation encounters to provide learning opportunities for our students. And the pandemic has provided us these opportunities, and we need to sort of figure out how we can use this going forward, even after the pandemic. So those are my only 3 points. So first, knowledge and practice gaps limit telehealth education. Number 2, we need to determine the telehealth competencies. And lastly, augment medical education with pandemic-related telehealth opportunities. Thank you.
Short and succinct. Thank you, Dr. Iris. Always a delight to hear from you. And a fellow educator, thank you for that comments. And actually online, our telehealth consultants, Dr. Namuel Famutagana, as well as Attorney Ivy Patlu, for which their own recommendations actually, some of them echo, and then yours is really an addition to that one. Buti na lang nakahabol ang ating third speaker today. So thank you, Dr. Iris, please stand by because we have a lot of issues in the polls. It's also a panawagan sa ating mga nakikinig ngayon. Can you please vote on the recommendations? And then those are the discussion points with all our panelists as well as our consultants. Okay, so our third panelist is a physician and a lawyer and a medical legal consultant. Dr. Book Castro finished medicine and law at the University of Santo Tomas and is actually a pathologist by training. He was once the president of the Philippine Medical Association and is currently the legal counsel of the Private Hospitals Association of the Philippines, a board member of the Philippine Hospital Association, and chair of the Committee on Ethics at the PMA. Dr. Wu Castro, welcome to our discussion.
Hello, yes, can you hear me?
Yes, very clear. Thank you.
Yes, I think the BANTAI COVID was detailed already by Dr. Atienza, so I'm going to flash to you the guidelines that we crafted for virtual practice of medicine as part of the mandate of the Commission on Ethics of the Philippine Medical Association. How do I share it? How do I share it?
We have... sandali lang po, ha?
Good afternoon po, Doc. Pag hinover niyo po yung mouse niyo sa taas po ng video, meron pong icon to share your screen.
Yes, I have it. And then?
I-click niyo lang po and then lalabas po dapat yung choices kung ano po yung gusto niyong i-share. It can be a tab or a window or yung buong screen niyo po.
Lumabas ba? Lumabas na ba? Hindi pa.
Wala pa po, Doc.
Wala. Anyway, to save time, we already have crafted, now it's being rerouted to all specialty societies, the guidelines, ethical guidelines of the virtual practice of medicine to govern members of the Philippine Hospital Association and to those who are voluntarily or will be voluntarily abiding by it. So it is a part of the Code of Ethics of the medical profession, and it is a long one. It covers history taking, it covers physical examination, the limitations of it. It covers laboratory and the ancillary procedures. It covers medical certificates, issuances. It covers consents. It covers even telephone call, which we discourage, except in emergency cases, and advertisements also in social media. The limitations in the virtual practice, including also the professional fees of physicians as far as telemedicine is concerned. So those are the basic contents of the guidelines in the virtual practice of medicine as far as the Commission on Ethics of the Philippine Medical Association. I'm just going to send it to you, but of course they're still being routed to all the specialty societies because there are very special peculiarities in every specialty. Like for example, in the practice of OB, practice of ophthalmology, where there are still gadgets to be used. So that is the initial, my initial report for this session. Thank you very much. Hello?
Oops. Yes. Hello. Yeah, there you go. Thank you, thank you very much, Dr. Benny, for that sharing. And we encourage everybody, especially the physicians, to review the issuance from the PMA. Dr. Castro, this is available on your website po. I know
Not yet.
you
Not yet.
routed it to all the professional societies, but
Yes.
yes, so we can the doctors can refer to that as well. Sige po. Okay, thank you very much for our three sharing. Go ahead.
Dr. Castro, can we also get a copy of your draft guidelines?
Sure, ma'am. Sure.
Okay, thank you very much. We will just if you can we'll just get it from you. So because we are crafting we also have an interim guideline on the practice of telemedicine, but this is only good for more for COVID-19. But for the general thing, we need to sit down and talk some more about it. Para it's what you call that? Every it's collaborative and everything is lang synthesized.
Sure, ma'am. No problem.
Thank you very much.
Thank you. Sige. Again, a reminder for you to look into the polls and your agreement or disagreement with some of the statements. Let me read one, and then maybe we invite Dr. Iris, Dr. Boo, as well as Dr. Atienza to comment and weigh in here, as well as Dr. Nemuel and Dr. Ivy, Attorney Ivy Patdu, our consultants who made the videos earlier on. Yeah. There is no need for additional licensing and accreditation for health professionals to practice telehealth. Yan. So although konti lang po, pero nangunguna ang disagree. What are your thoughts about this? There is no need for additional licensing and accreditation for health professionals to practice telehealth. Yan. Can I hear from the only thorn? Dr. Iris, what do you think?
Okay, so the proposition was stated in a double negative. There is no need. Okay, so maybe that might have confused some people, but I will agree that there is no need for additional accreditation process. But when we say that, then we need to say that we also need to upgrade our health professions education curricula to make sure that telehealth competencies are included in this curricula. And what's interesting about the pandemic is I've been trying to look at all the publications for different health professions like pharmacy, radiology, or nursing, etc. There's a lot coming out now because globally everyone is scrambling how to continue with health professions education. So there's a lot about telehealth. All the competencies are being discussed. So I'm very happy to be in this panel and to know that there's also work being done here locally to finally determine what the competencies will be. So short answer, yes, I agree, no need, but we need to upgrade our health professions.
Okay. Dr. Atienza, PMA, what do you think about that po? There is no need for additional credentialing.
I think for the doctors, we need credentialing, especially kasi baka mamaya ay nagbibigay ng advice, hindi doktor.
Oh, okay. So that's an issue at this point. Okay. Maybe we can call on Dr. Nemuel Fahutagana, also an educator. Can he come on board? Dr. Nem? Makakapasok ba siya? Okay, Dr. Nemuel. Sige. Hirap pa. So, there you go. Maybe Dr. Castro, can you weigh in also?
Certainly. Well, taking off from Dr. Benny's response, if the doctor is ascertained, identified already, insofar as separate licensing, for me, there's no need. There's no need, yes.
Okay, thank you. Hindi pa makapasok si Dr. Okay, let me read one question and balikan natin si Dr. Nem.
Hello, can you hear me?
Yes.
You know what? In the UHC law, I'm not very sure, no? Pero diba, parang there should be the doctor who practices telemedicine should be credentialed by no less than PRC.
Okay. There you go.
I think I better check, but I think I read it somewhere. I'm not sure if it's in the IRR or it's in the law.
Yes, I think it's in the e-health bill.
Or it's in the bill. Baka sa e-health bill. I've been reading so many.
No, it's
You want
that's
to share? Yes,
yeah.
doctor.
It's in the law that telemedicine is recognized, but the mechanism of licensing, accreditation, there's no specific yet.
Baka sa e-health bill.
Yes.
Yes, ma'am.
Yeah.
So, health bill po.
And I don't have a copy of that.
So, siguro iba yung licensing versus credentialing, di ba? Then yung magandang clarify as to the processes at this point. Sige. Let me read a question from the question box for Dr. Castro. How can the PMA ensure that the current health workforce, particularly the physicians, are capable of using various telehealth solutions and of keeping abreast with the future developments in health technology, their profession? So
Well,
how can PMA ensure that the workforce is ready to use technology?
It could start from medical education as early as in the College of Medicine. That's why there's no more need for separate licensing if we incorporate it in the medical education. So even in residency training, postgraduate internship, this can be boosted as far as skills are concerned. But the thing is, there should only be one standard for telehealth medicine in the Philippines.
Okay.
Yeah.
Sige, tanongin natin si Dr. Iris is an educator. What do you think? So the question is, how can PMA ensure competency for e-health?
Even before the pandemic, there was a SHED memorandum order that defined outcomes-based education, at least for medicine. And if you look at the required subjects there, informatics was included. And at least for the UP College of Medicine, we've been discussing telemedicine in our informatics elective for second-year medical students. And then, since we also have the master's degree in health informatics, we discussed telemedicine there. So I think the problem now is actually making sure it's incorporated into the other clinical activities as well. And we're starting to see that with people trying out teleconsultations. It becomes part of the clinical training as well. So we're really looking forward to having the PMA or the UH together to actually come up with these standards.
Okay. Yes. Okay. May tanong po tayo from the others also. How can the academe and professional societies work together to produce appropriate regulations as well as profession-specific or specialty-specific practice standards? Are there any efforts? I will call Dr. Nem. Finally, he got on board.
Is there no need for
recommendations about how professional societies can produce regulations that are profession-specific? What are your thoughts on that? Dr. Nem? Dr. Nem, well, ayan. Hello, we hear you. Thank you. What
Can you hear me?
Yes, clearly. Yes. How can the professional societies? Go ahead, Doc.
Yes, go ahead.
How can the professional
I
society?
didn't get the question kasi
how can the academe and professional societies produce appropriate regulations that are profession-specific or specialty-specific in the practice of telehealth? How can the professional societies
okay.
contribute?
We all know that the professional societies already have their own practice guidelines in terms of, for example, special society like Dr. Irish endocrinology or those in pulmonology or PCP and all other societies have all their practice guidelines. So this controls the quality and the type of services that they can make available to their patient. What we don't have is basically the standards in terms of delivering this through the telehealth or the e-learning, e-health program. So what we will try to do, as mentioned in our previous session last week, and of course as presented by Dr. Iris, is that we really need to define very well what exactly are the competency requirements to be effective telehealth practitioners. And that this would not only involve competencies in the direct health services, but basically the very basic soft skills that may be required to deliver telehealth to people in the communities. Kasi minsan, iba yung, sabi nga ni Iris kanina, iba yung ating required na attitude and the way we deliver and the way we communicate with our patients online and the way we communicate with them offline or direct face-to-face. So the societies will have to really, as I said, add on lang. Kasi may mga residency protocols na tayo. For example, I'm sitting down with the Philippine College of pulmonologists, and they have already residency guidelines, fellowship guidelines, and sort of thing. But what is not in there is the telehealth guideline. So this is something new. This is something that we need to still address very well. Iris provided already several literature, but I guess we really need to run a very robust competency analysis that we can give and advise to the specialty societies.
Yes. Actually, special mention to the Philippine College of Radiologists, who actually was, I think, the first in the Philippines among the professional society to develop telehealth guidelines for teleradiology. I'll call on Iris. So what is your experience?
Just to add, last May 25, Dr. Mario Panaligan, who's the current president of the Philippine College of Physicians, allowed me into this meeting with the component subspecialty societies of PCP to talk about specifically telemedicine guidelines. At that meeting, I asked for the different component societies to submit two things. Number one, a list of virtual PT maneuvers that can be used. We did have a preliminary literature review, but this literature review looked at published studies. So I knew that our experts would probably know some more virtual PT maneuvers that are not published, so we asked for a list. Second, we asked them for a list of what are the cases appropriate for being seen via telemedicine, because then we would have to figure that out, and who will be seen on an emergency basis, etc. So the societies have already submitted those to the PCP, so I have them. The next step is actually they're discussing now what changes will be made to the residency program, at least for internal medicine, because they're trying to dovetail what are the cases that are essential to be learned by the internal medicine resident, for example, and then how does that relate to the patients that can now be seen via teleconsultation. So, for example, we agreed that type 2 diabetes patients that are stable can be seen via teleconsultation. We're reviewing the literature if you will allow diabetic foot, for example, because some say do not see them via telemed, and then there are some studies that say they can see. So these are the things that are happening. And as I mentioned earlier, we also have the very new UP Manila Telehealth Committee where we have all the colleges. So we're also trying to put together what do they have right now that would pertain to telehealth.
Yes. Okay, so everybody's really working hard and, well, harder actually the next few days. We really have to catch up on this one. But let me also comment when we're talking about telehealth, when we first started, telehealth, it's not only within the current area where people actually have access, right? So I hope the professional societies, the academia will also start considering where are the most difficult communities where telehealth is much needed. So even that kind of cultural competency, weaving into telehealth education among in-service as well as pre-service health professionals should be greatly considered. Okay, I'll call on Charity for the next question. Thank you.
So, you know what? Today's discussion just talaga highlights the need for a law on telehealth. And I know that Congress, the Senate and Congress are pushing for the inclusion of telehealth, telemedicine in the e-health bill. So, at saka ngayon, kung wala lang sigurong COVID, grabe na yung interest ng Congress and Senate for in the passing of the e-health bill. Kaso everything like sort of stopped since March. So this should be incorporated na talaga. So, but before that, I think everybody has to sit down and once and for all say na okay, get all the stakeholders together and for everybody to craft na the position of the health sector for submission to Congress. So yun lang.
Sige. May nagpapabate. No, we want to greet also from NKTI. They are practicing tele-rehab in the facility at this point. Let me ask another question. Can you respond to our participants' view that non-medical personnel should undergo training and competency analysis before they are allowed to be part of the telehealth workforce? Yes. And non-medical personnel should also undergo training. What do you think about that, Attorney Dr. Ru, Attorney also?
Yes, definitely, yes. They have to undergo training, especially for validating, not validating, but for taking blood pressure, for example, taking temperatures. So those are things that we have to train non-medical personnel.
Kunyari EMT.
Yes, yes.
Yes.
There are procedures that they have to be trained because the doctor is not present. So that's very important.
Sige. Dr. Atienza, do you have anything to
I
comment
think
on that?
the non-health workers should be trained. Like what I'm doing, I'm training the health workers, child-related health workers, and now they are doctors, nurses. This is a 25-year project of mine. This is we call it child-related health workers, teen health workers. I train them how to get the height, the weight, the temperature, and now we have graduates, may mga doctors na tayo, maybe pathologists, and they're sharing their knowledge to the community.
Sorry, I found the passage I've been looking for in the e-health bill. It says here, Article 5, Telehealth, Regulation of Telehealth Services and E-Health Related Devices. Of course, it's the e-health council through the DOH shall establish and maintain a regulatory system for telehealth services and e-health related services. Okay. In Section 16, standards of practice and certification of individuals and entities providing telehealth services. To complement the regulation of telehealth services and e-health related devices, the PRC, the Philippine Regulation Commission, and DOH, in consultation with PhilHealth, UP Manila's DICT, academia, medical and specialty societies, non-government organizations, and the private businesses shall set the standard of practice and implement a certification mechanism for healthcare providers and health-related entities providing telehealth services. Also, yun. So this is already incorporated in the e-health bill. That's already in the first reading.
Definitely, the feedback of our listeners can actually weigh into that one. Iris, what are your thoughts? Non-medical personnel should also undergo training for telehealth.
Okay. Definitely, ma'am. Even before, when we were talking about e-health, and when I worked with you on the RX Box project, so we were thinking that everyone should have training. The only thing we're going to decide is what level of training is needed. So, for example, our IT people will not only need the IT know-how, but they need to be trained about the data privacy act. They need to be trained about the quality of the data, for example. And the second thing that I'm going to talk about is the training for what we call telepresenters. So as you
Yes.
know, we don't have enough nurses, midwives, barangay health workers, or doctors. And if I'm the clinician and I'm trying to talk to the patient, if I say, for example, can you examine your thyroid by doing this, extend your neck, etc. But if I say, okay, does your thyroid feel soft, hard, or doughy? Of course, the patient cannot answer that. So that's why we need training for telepresenters who can actually serve as our hands to palpate, for example, and then can tell me some of the findings. So that's one way to make telehealth work.
Yes. Nice. Okay. You know, that's an exciting hour. Our last question will be read by Charity.
Where is the last question?
Oh.
Please, this is for Dr. Iris or Dr. Boo. Please comment on the proposition that all who are involved in various telehealth solutions from back end to front end, including the non-health workers, professionals, are considered part of the health workforce for telehealth.
Yeah, no, it's the same. Yeah.
Yes, definitely. Especially if we are to apply telehealth in the primary healthcare in the UHC.
Okay, thank you.
Yes.
Iris, may dagdag pa?
That's it. So we really need to provide training at different levels. So that's why the competencies is where it's going to start. So if you say an IT person with the competency, you need him to know about the Data Privacy Act in terms of health information, for example.
Yes. Maybe just to underscore our experience precisely, Dr. Iris helped us, and in the rural health units, there we also trained IT personnel of the local government so that they can help the doctors, the nurses do this. But at the same time, yeah, just to underscore, this healthcare. So there is ethics in the care of patients. They themselves are actually trained on that aspect. They have to also be aware about the Philippine healthcare system, their local health system, so that they are competent and more supportive of what they are doing in that health facility. So yes, definitely. Okay. Okay. So, that was a spirited one hour. Thank you very much to the 914 who have logged in, listening into our conversation. This telehealth platform has a way of getting your comments further. Last words from our three panelists. Dr. Castro, yes, sir?
Yes, I just suggest that everyone monitor what is happening in Quezon City, the BANTAI COVID. Telemedicine is just part of it. Telemedicine is just part of it. It starts from contact tracing to referral to hospitals to laboratories, all linked in one API. So please watch that what's happening in Quezon City. Thank you.
Thank you. I need to greet Dr. Belen Dofitas, who initiated teledermatology a long time ago. One of the pioneers. Sige, sumingit. Dr. Iris, your last word, please, for our audience also. And things for us to think about.
So we look forward to working with all the stakeholders from the academe standpoint in UP Manila. And I've heard and I've read from the chat that so many people have been using telemed. I think there was someone who said they were using telerehab, etc. You know what's missing right now is people writing up all their telemed what do you call that? Implementation. For example, if there's anti-COVID, I hope that somebody will write about it so we know exactly how that was done, and that can now become teaching material for our students. So if you look at the COVID literature now, there's a lot of how did we do this articles. So they tell us how did we do a virtual OSCE. This is how we did it, Zoom breakout room, etc. So we need those kinds of write-ups, and hopefully we will have a lot from the Philippines because people are doing things, they're just not writing them. Thank you.
Yes. Thank you. Yes, we are compiling. So far, we identified 90 telehealth providers or solutions. But it's the end users, Anna, your story, please share them precisely because we have the team who compile all of these at this point and sift through them and maybe be used for the academe, the professional societies, and definitely for policy. Sige. Dr. Atienza, yes, please. Your last word. Yes, sir. Dr. Atienza, your last word po. Huling bilin para sa aming Dr. Atienza, we can hear you. Yan.
Yung last will, bro, last will.
We'll remind our doctors that the Philippine Medical Association is doing all its functions, especially Commission on Ethics. We are doing the telemedicine guidelines. It will be incorporated in the Code of Ethics of Medical Profession as implementing rules and guidelines.
Okay, thank you very much. Marami rin po nagpapabati. So, hello to everybody. Thank you very much again.
Ay, last word ko, Miss Portia. Can I say something?
Go ahead. Go, Dr. Charity. It's your turn.
Yeah. Actually, di ba, before, iba itong telemedicine eh. Kasi COVID has created a demand for telemedicine. So, palagay ko, ang kailangan natin is we have to make sure that the supply of telemedicine is safe, is within standards, and within the data, and practices the data privacy guidelines set by the National Privacy Commission. I think yun dapat ang kailangan natin. So, thank you very much.
Okay. Charity, as the Department of Health, you have the responsibility of closing your session.
Yes.
Go ahead.
Okay. Sana yun?
Thank you again, guys.
Oh, thanks. Thank you, everybody. Please like and subscribe to our Facebook page, fb.com/telehealthpolicy, and on our YouTube channel at bit.ly/T, telehealth capital T, policy capital Y, and capital T. Why do you have to make it so difficult? But later today at 5 p.m., we will premiere the introductory video for our next week's session. So, Telehealth Strat Invest. Again, another Gen X talk. Paving the way for a sustainable and equitable health financing in telehealth. We have another exciting list of speakers, including a colleague connecting from Bern, Switzerland. Oh, salamat muli, and don't forget to use hashtag Telehealth Thursday. So thank you very much, and hope to see you tonight and next week as well. Salamat.
Okay.
Thank you po.
Maraming salamat po lahat. And pahabol po, if you are a telehealth service provider, please answer our survey through the link shared in the screen. Thank you, everybody, and have a safe week ahead. Bye-bye. Thank you, Dr. Atienza.
Thank you po. Thank you.
Thank you, Dr. Castro. Iris, thank you so much. Everybody else, hello.
Thank you.
CJ,
Bye-bye.
ang ating mga RPs. Nice to hear from you. Bye-bye. Thank you, team.
Hindi ka magsalita, sir. Pwede ka lang magsalita. Tapos na yun. Okay na, sir. Sir Manu.
Hi, sir. Salamat po.
Wala na, sir. Nadalawa na natin.
Ano po yun, yung dalawa. Gusto niyo po, bukas na lang yung iba. Ang haba.
Pero pa, sir, yan pa.
Isa't kalahating oras na lang po yung bukas.
Okay. Pwede, sir, mga kung sakali, kung isa't kalahati sa mga 4 o'clock.
Sige po. Gawa na ulit ako ng calendar invite para 4 to 5:30 po, no?
Sige, sir.
Sige po.
Okay, sir. Approve.
Salamat, sir. Salamat ulit.
Ingat, sir. Salamat din. Madam. Ganyan na. Umutulo po yan pag nasarado. Nabaksak mo kasi. Pinan yung pag yan